This is the side position routine for the Japanese massage course. First of all, sit beside your client who is lying in the side position. Make sure they're comfortable, have cushions under their head and they're lying in a comfortable position. And you can check if they need a cushion between their knees, but your knees okay. Then sit in beside your client. We're just going to start off as we normally start off, just holding the back with this hand, the upper back. This hand is around the shoulder blade, around the shoulder, and we can just palm around very lightly around the shoulder and upper back, just moving the hands around. And we're going to come in to do a shoulder rotation. So I'm going to hook my arm underneath, hold it at the front of the shoulder and behind it the shoulder blade, and rotate the whole shoulder girdle backwards slowly. You do this a number of times. Then we're going to come in and actually rotate the shoulder joint itself. I'm going to pick up the arm, support here at the shoulder joint, and do small rotations. I don't really do a big rotation for this. I can feel underneath my hand the joint rotating. Again, slowly. This is going to lead into a stretch. I'm going to bring the arm above the head. I'm going to hook around the elbow. This hand can come down to the pelvis. I'm going to stretch, breathing in. And the out breath, I'm just going to sit back, lean back, and stretch. Breathing in. And the out breath, I'm just sitting back and stretching. We can come in to do another stretch. I'm going to kneel like this, and thumb hooks around the thumb. This hand comes around the elbow, and we're going to stretch up and back on an out breath. So breathing in and breathing out, stretching up and leaning back. Breathing in and breathing out. Okay, and put that arm down just on the side of the body. I'm going to come up and do a little bit of work on the head. So I'm going to hold the head with two palms. And first of all, I'm going to lean just gently into the front hand. And then into the back hand. I can move the back hand back a little bit and lean in there again. I'm going to repeat that. Leaning into this hand first of all. Gently on the side of the head. Then the right hand and the right hand. This hand can be the mother hand now, as I use the thumb to work around the ear. Just coming down to underneath the occipital ridge. And repeat that. We're just working around this line around the ear. Down into the occipital ridge. I can do another line just further back from that. Again, coming down into the occiput, and I can repeat that. So this hand is supporting the mother hand. Just leaning in, remember not to push or press, just leaning in. And to the occipital area. Okay, we can do a little bit of work on the neck itself. First of all, in the palm, we palm under the occiput, just across towards the middle. So the heel of the hand is fitting in underneath the occipital ridge. And we can use the thumb to go in there. So I can kind of hook my thumb starting behind the mastoid bone, beneath the mastoid bone, and coming across underneath gallbladder 12, gallbladder 20, coming across the bladder 10, and I can repeat that. Then we can a little palming down the neck, so the palm kind of fits into the whole of the neck here, so I don't have to move my hand down. So don't put the fingers too far across, otherwise you impinge on the front of the throat area. Give the fingers back, and I can just lean in there 3 times. I don't have to move my hand up or down. I can't do it with the other hand, but when you do use it with this hand, the palm fits in nicely into this part of the neck as long as the fingers aren't too far forward. This hand is more the heel of the hand coming in, and you're bending your arm a little bit. So this one is nicer. Then we can use the thumb to work so the fingers come in under the other side of the neck. And we can start with gallbladder 12 and use the whole length of your thumb to lean in. Down to the top of the shoulder. So I'm working the whole of the side of the neck at the one time. A variation on that is to kind of stretch it across rather than just leaning in. You can do a nice stretch across. Stretching. Stretching across. If you find this catches your back, I can move to the head. So I'm going to move to the head. And this is really for working down the neck and underneath the occiput. You can't use your palm under there, but you can use your thumb. So I could work into the occipital area with this thumb. Sometimes this position is kind of easier on the back. Just an alternative position. I can still work into the 3 points across the occipital area. And the other hand can support on the shoulder. And then I can work down the neck so I can lean in, as we did from the other position. And I can come right down to the top of the shoulder from here, which is quite nice. We work across the shoulder. So a little advantage in this position. So I can do the stretching technique across, stretching these muscles across. Right down to the shoulder. I can do a little stretch. I can hold my hands either side of the shoulder, breathing in. And the out breath, and just give a little stretch. Stretches the whole of the neck and the top of the shoulder, trapezius. Make sure the arm is resting on the side and isn't toppling off. Breathing in and breathing out is leaning into it, stretching the whole length of the neck and shoulder. Okay, we're going to come back into this position to do some work on the upper back. The work here, I'm going to do it in sections, so this is working around the edge of the scapula. So I can feel the scapula here. And I can work into the ladder 1, so I can look for the process of the spine there. Move my thumb in beside it and work the top points on the bladder meridian there. So that's 2 separate places. That's right in beside the scapula, bladder 2 or kidney channel, and bladder 1 just in beside the process of the spine. Sometimes if you bring the arm into this forward position, it kind of opens it up a little bit actually. I can just opens this area up a little bit, probably a better way to do it. So I'm working in beside the scapula there, on the kidney channel. So I'm not going too far down, I'm just keeping my fingers here. So I'm not overstretching. And I come into find the process and work into the ladder 1 channel. Again, just the upper back, we're working in this. Another technique we can do is we can bring the arm back and we can put the fingers, hook the fingers in underneath the scapula and kind of lift the scapula up and off. And we're really getting in underneath the scapula. Some people you will feel this more than others, depending on the sort of muscular bulk around the scapula. You feel it more or less. It just helps to loosen that whole area. Just lifting that, stretching that off. I can put the arm back in the forward position, and we want to do some work along the rest of the back. So I can decide which thumb is going to work better for me. I'm going to continue on where we left off. So I'm going to work on the bladder 1 channel. With my thumb. Keeping it beside the process, right down onto the sacral area, and keeping the process there, keeping it beside it, onto the points on the sacrum. Right to the end of the sacrum there. Now I can go back up and repeat that, and I can also work the kidney channel here, which is running beside the inner edge of the scapula. This time I feel the pelvic crest here, iliac crest, and I just come over it, down onto the sacroiliac area, and just onto the top of the side of the sacrum to the top of the gluteal muscles. Now I can go back and repeat that. Do some work on the hips. So a nice one to do is we can double palm. So these fingers lie across the front, fingers lie across the back. And just lean in. Lean in. Another technique we can use on the pelvic area is to use the forearm, again doing our kind of pulling motion. And want to work this line near the top, not quite on the side, just off the side. And I'm not just leaning in it, I'm drawing the arm back, get a nice ease into the areas. I sit back a little bit, I can come a little bit further towards the midline and work on these areas. So I'm really charting out two channels, one roughly here and one roughly here, coming in a kind of a semicircular form. And I'll just finish off this section by just palming again. Well, we could use, if we need to, we could use the thumb in there as well. While we're here, we can do that. It's an alternative technique. Again, following these 2 or 3 channels along over the pelvic area. In the areas of the sacrum here. And we finish off this section with a little double palming and hold. That finishes this section, back, the neck, the head, and the pelvis. We work on the legs now.